Good evening, everyone. This is Lloyd Smucker, Congressman for Pennsylvania's 11th District, which covers Lancaster County and the southern part of York County. I'd like to thank you for joining me this evening for a telephone town hall to discuss what's going on in Washington, D.C. and in our community as well. Many of you have joined us before on these calls, and so I'll repeat myself a little bit here in the beginning as we get started and as people are joining us on the call. But we will very shortly be getting to your questions, and we'll take as many questions or comments as we can over the next 60 minutes or so. To do that, if you have a question or a comment, we welcome that, and the way you do that is press *3 on your telephone. You can do that right now. You'll be connected with a member of my staff who will take your question, and then you'll be put in a queue, and we'll get to, again, as many as we can. So again, repeating myself because people are joining us as I'm talking, this is Congressman Lloyd Smucker. I'd like to welcome you to our telephone town hall. We do these on a regular basis. It's a great way for me to speak with you, hear what's going on, hear what's on your minds, and get generally very good feedback throughout the district of people who've joined us on these calls. So again, it's Congressman Lloyd Smucker. We'll have a telephone town hall that we'll be doing here over the next about 60 minutes or so. If you have a question or comment, press *3 on your telephone right now, and you'll be connected with a member of my staff. You'll be put in a queue. We're going to get to just as many people as we can. I do want to provide just a brief status update of where we are in our fight against the coronavirus, COVID-19. Of course, this is a year that I think, back in January, February, none of us could have predicted. It's been a challenge for each of us to adequately, to first understand what's happening with this virus, and then to respond in the right way. I think one of the most important data figures that we should all be looking at in Pennsylvania, here locally, and across the country is our hospital capacity, which was the reason for an economic shutdown in the first place. Economic capacity, how many people are in the hospital with COVID, how many people are in intensive care in the ICU, intensive care unit. And then initially, at least when we were using more ventilators, doctors have moved away from that to some degree, but how many people were on ventilators, and how did that compare with the capacity that we had? And remember, when we started talking about this in February and March, it was all about social distancing to ensure we stop the spread and slow that peak, and stop that peak from overwhelming our hospital systems, which would increase the number of deaths and so on. It's, I think, important to keep that in mind, and I want to just remind you what some of the initial modeling was showing for our area. One model, which was released in early April, which is known as the CHIME model, was developed by Lancaster General and Penn Health. Of course, LGH is a part of Penn Health. There was early in April, we were all worried about how it would be impacting our hospital systems here. Of course, in Lancaster County particularly, LGH is the largest. But the model at that point showed that projected that by May 31st or June 1st, there would be about 1,500 patients with COVID-19 in the LGH hospital receiving treatment or in the system. That same model predicted that there would be nearly 600 in ICU on May 31st, 600. And thankfully, despite the tragic deaths that we've seen in the county, But thankfully, none of those predictions from that model proved to be anywhere near correct. In fact, as of May 31st, when we were predicting, I said nearly 600 to be precise, there's about 580 patients in the ICU. There were 14. 14 compared to 580. Now, that's not a criticism of the model. It's not a criticism of our healthcare systems, the hospital system. It's just demonstrating what data was being presented months ago. And as we've progressed with the virus, we've learned a lot more about it. We've learned that it disproportionately impacts those who are elderly, those who have chronic illnesses like hypertension, diabetes, and then, as you all probably know by now, those who live in congregate facilities like nursing homes and long-term care facilities. And it's been tragic, really. We've also seen that the administration here in Pennsylvania, Governor Wolf administration, did not follow the guidance from CMS, which is the Federal Centers for Medicare and Medicaid Services, which said that nursing homes and long-term care facilities should only accept patients who may have been exposed to COVID if they can follow CDC quarantining guidance. And the problem is a lot of the nursing homes and long-term care facilities were at capacity. I was talking to one several months ago, right in the midst of this, that was at 98% capacity. They had absolutely no way to quarantine and separate patients who had COVID. At the same time, they were being forced to accept people who had been exposed to COVID. Now, only 5 states, including Pennsylvania, took that kind of action that did not follow the CMS guidance. And we've seen some tragic results here in Pennsylvania as a result of that decision. Over 4,600 individuals who were residents of nursing homes or long-term care facilities, over 4,600 have lost their lives to COVID-19 across the Commonwealth. And that is 68% of all total deaths in the state. Recently, I joined some of my colleagues in the House from Pennsylvania and members of the House of Representatives Select Subcommittee on the coronavirus crisis in asking for Attorney General Josh Shapiro, this is Pennsylvania's Attorney General, to investigate the administration's actions on nursing homes. And earlier this week, in a conference call, the Attorney General's office confirmed that they do have an ongoing, and I quote, thorough, holistic, and wide-ranging investigation on this matter. And I appreciate their willingness to do that, their diligence into looking into this matter, and look forward to the results of that investigation. That's just one matter I've been working on. There's so many to discuss. I think rather than going to any, I think we're just going to go ahead and turn to your questions. And again, for those of you who have been joining us, if you have a question, you can just press *3 on your telephone. You can do that right now. A member of my staff will answer the call, and you'll be put into a queue. So with that, let's get to our first question. Let's go to Andrea. Andrea Ingrassi, I think. Are you there?
Right here, dear. How are you today?
I'm doing fine. How about you?
Oh, we're hanging in there. I'm just going to go off a little bit. I know you're going to take a lot of questions about the terrible virus, and I understand the crisis that we're going through. But at this time, I just needed some other question answered, if you could.
Happy to.
Okay. We've been Republicans for so many years, my husband and I, and we're senior citizens. And I just wondered why no one ever addresses the fact that Social Security sometimes gets no increases or a very small amount of an increase each year, yet Congress and everyone else gets a big increase in their pay.
Okay.
I wonder if you could address that for me.
Well,
I get like $589 a month. I don't know how anyone can live on that, but we manage.
Yeah, well, I appreciate your question, Andrea, and thanks for joining us on a telephone town hall. I can tell you how those Social Security checks are calculated, or the increases are calculated. It's essentially a cost of living increase based on rising costs of inflation. For it's a certain measure that's used, and so as prices are increasing, Social Security prices or Social Security checks would increase as well, I forget exactly the measure that we're using, but there's been debate around exactly the measure that's being used, and so but that's exactly how that's calculated. In regards to pay increases for Congress, we do not receive an annual pay increase. In fact, I know there hasn't been a pay increase in the time that I've been there. And I think it's been some time, I don't even know the last that there was a pay increase for Congress. We don't have anything that's tied to inflation or anything of that sort. It essentially has to be legislation. And so that's how the congressional pay is handled. So, if there is a specific question that anyone has on the call in regards to Social Security, we're happy to look at that to ensure that it is being calculated correctly. We've helped a lot of people access, Social Security when it wasn't being adequately, when there was some factor that was preventing the amount to be what it should be. I think by and large, most people are getting the right amount. But we are always available at my office to help if you have any questions. So thank you for that question. Let's go to the next caller. We have Shirley from Lancaster. Are you there?
Yes.
Hi, Shirley. How are you?
Fine today. I have your phone number. I got it out of the newspaper, but I never gave you a call. I was just saying I had the paramedics come here for me because I was having trouble breathing, and they said to me, do I keep my mask on in my apartment? And I said no, because I'm here alone. I mean, I live in a big building, 200 people, but I'm the only one in my apartment, so I said, no, I don't keep it on in all the time. We don't have to, do we?
It's a good question, Shirley, and I do want to say that this the short answer is no, but I want to just expand on that a little bit, and that is that we all will be living with this virus for some time. There are treatments that are being developed, some with very good promise. There's a vaccine that is being developed at a record pace that hopefully will begin to be available by the end of the year. But that means that there'll be months here where we will still be living with the virus. Now, I believe many of us can go about our daily business. We can open businesses. We can go to work. But we have to continue to socially distance, and we should continue to wear face masks when we're in public, when we cannot socially distance, and when we're in a public space. And that's the CDC guidance, as well as the guidance from the secretary here in Pennsylvania as well. We are not required or even recommended to necessarily wear face masks in your own home. That is not generally necessary. You should be wearing a face mask when you're exposed to someone that you do not live with on a regular basis. So I'm not sure what they were telling you, but the answer is no, you do not need to wear a face mask if you're living alone in your own apartment.
Okay, thank you.
Thank you. Let's go to Deb, who says you're a misplaced Texan living in Pennsylvania.
Yes, I am.
How long have you been in Pennsylvania?
We've been here almost 10 years. Now,
well, we're glad you chose. Are you in Lancaster County?
Yes, and my husband works in Northeast Philly. He got sent home today.
Yeah, well, we're glad you chose Pennsylvania. So what's on your mind today?
He works on helicopters. He's quality control.
Oh, does he work at Sikorsky?
No, that was initial. Now he works at Leonardo.
Oh, okay, great.
All right.
Well,
so
we appreciate that.
He got sent home today because one of the guys in the Air Force hangar contract tested.
Oh.
Yeah. So my thing is, now listen, we live in Lancaster County. We're actually in Stevens, actually part of Reamstown. I love you because I love Republicans. Okay.
Thank you. I love you too.
I have to say that. I do.
Thank you.
And we are pro-Trump and pro all of that. Now, the thing is, if people don't feel safe, then wear the mask. Stay home. If they need to go out, then wear a mask. I have gaiters all over for us. Some of them are really cool looking.
Sure.
So stop bothering the rest of the community. If you don't like it, then don't do it.
You mean with wearing masks, Deb, or what are you referring to?
Yes. The thing is, and here's my other issue, okay? And I'm going to say it, I am. The media is pissing me off. All right, yes, I said it. I did. I said the P-I-S-S.
Yeah, well, Deb, we have a lot of questions. So I'm going to get to the next one, but I do, I agree with you to a point in regards to masks. I mean, I do think, like, when I go out and I'm in public and I'm interacting with people who I don't live with, I wear a mask. And I follow the CDC guidelines in that regard. I think you're protecting your own health and also protecting people who are vulnerable. And so I think, you're not only doing it for yourself, but you're doing it for other people who could potentially be exposed. As I said earlier, I have felt for months now that we can effectively protect ourselves and socially distance while we keep the economy going and reopen businesses. The economic damage, people who are losing their jobs, are not able to provide for their families, who are in danger of losing their businesses after pouring their lives into it. There's a huge impact if we continue to keep the economy closed down. And obviously, we want to also check the spread of the virus. We have done that effectively and can continue to do that while we reopen. But I appreciate the comments and thank you for joining us. Let's go to Richard. Are you there? Richard Ryan.
Yes.
How are you doing?
You hear me?
Yes.
I'm doing fine. Are you doing fine?
I'm doing okay. Thank you.
Okay. My question is about, okay, I've lived a very full life. I'm a senior, okay, among other things. And I don't know whether I'm just looking at it from a different perspective, but it seems to me that the Democratic Party, okay, is trying to overthrow the Democratic government with their attacks, okay, for open borders and all these other things, okay, which are allowing people to come in and causes a great deal of difficulty, not just from the point of money, okay, and helping them, but trying to discredit the government. Now, I've seen this happen, okay, in other countries, and I've also seen, okay, which is very concerning to me, is that these people, okay, think that they have the right to tear down statues just because that person that is that statue or represents that statue had some small error in his life.
Yeah.
And I don't understand why our government, is not taking action against that, because it's really tearing down the history of all Americans that came before these people.
Yes. I completely agree with you, Richard. And I don't know if you had the opportunity to see the president's speech at Mount Rushmore. Despite what the media has said about that, I thought it was an excellent speech, really talking about some of our founders and others who have made our country what it is. Now, we know initially that grand experiment that our founders took on to create a country that created more freedom, created more economic opportunity through the economic system, more wealth, lifted more people out of poverty than ever before in the history of the world. It wasn't perfect, and the Constitution didn't initially extend those freedoms to everyone. But we are making progress as we go, and we can learn and we can continue to make a more perfect union, if you will. But boy, we cannot forget the principles that this country was founded upon. We can't ever forget all of the sacrifices that were made by so many people to provide the kind of freedoms that we all enjoy. And that's what concerns me a lot in regards to this attempt to, the way I look at it, almost erase history by just tearing down monuments. We have members of Congress talking about replacing our entire economic and political system. Now, what is that? What does that mean? And frankly, why would someone like that be serving in Congress? We all, as members of Congress, take an oath to defend and uphold the Constitution. Yes, we can continue to build a better nation, but boy, I'm proud of having the opportunity to live in America. So thank you. I appreciate those comments. Let's go to John. Are you there? Oh, John, is it Tumolo?
Yeah, that's me.
Hi, John.
The only comment I made, I said earlier, I think it's fantastic that you're doing this to get the information out to the people. I may not agree with everything you say or do, but at least we're informed, and I think you've taken the time to inform us is a big plus. Thank you.
Thank you. I appreciate that. I'm sorry, I was having a little trouble hearing what you said, but I think you said you agree and you just appreciate what we do. So I thank you so much for that comment, and I appreciate you joining us. Let's go to Barbara Kaufman. Are you there?
Yes, I am.
Hi, Barbara. How are you?
Okay. I work in a nursing home facility, and I was wondering why nursing home facilities and other healthcare workers, I think we deserve that $600 that you're giving unemployed people extra a week.
Where do you work, Barbara, if I may ask?
Ephrata Manor in Ephrata, Pennsylvania.
Yeah, and how has it been for you working through all of this?
Well, we're getting tested every 14 days now until we can't become altogether negative.
Yeah. Well, so first of all, thank you. You're really on the front lines of this, and we appreciate what you and all of our healthcare workers are doing. There are others who are in the food supply chain. When things were shut down, they continued to go to work every day to ensure that we all had food on our table, and they responded quickly to changes in the supply chain. So, everyone who's working as an emergency responder in our nursing homes, in our hospital systems, and grocery stores, truckers, and so on, we just really, really appreciate what you've done. You are very much, Barbara, in the front lines of this. So thank you. The CARES Act provided that $600 as a temporary aid to people who lost their jobs as a result of this. That will expire, by the way, on July 31st. There is not a specific reimbursement for additional pay for healthcare workers, but there's a lot of assistance for hospitals and nursing homes and so on. And I do know that, some companies that, where employees were still required to come in, made some provisions to help employees through that. It's a good idea because we do so much appreciate what you're doing. So thank you for your service. We do potentially have another aid package that we'll be working on probably by the end of this month. And so it's one of the things I'm actually very interested in hearing from folks if there are ideas for where additional help and assistance is needed. We're certainly willing to listen and hear how we can be most helpful. So thanks for that input. I really appreciate you being part of the call. Let's go to Timothy Weaver. Are you there?
Yes, sir, I am.
Hi, how are you doing?
I'm doing fine, enjoying the heat.
Yeah. Looks like we're going to have a storm here shortly.
Actually, the one's bearing down on me right now.
There you go. It'll take off a little bit of the heat anyway. What's on your mind?
Well, I am very concerned about property tax reform. I remember back way in the very beginning of the Pennsylvania state lottery, that was going to be the thing. That was going to reform, help seniors pay their property taxes and this and that. And that lottery has grown to be a huge industry along with gambling, and we still do not have property tax reform. For anybody that's over 65 and retired, I don't think should have to pay property tax on a home that they've owned for 35, 40 years. It's just ridiculous. It's getting completely out of hand for people on fixed income.
Yeah, I appreciate that concern. It's one we obviously hear a lot. I was in the state Senate for 2 terms prior to serving in Congress, and it was one of the issues that was sort of top of mind for folks in our area at that time, and it still is today. It's partly driven, and it's a state issue, not federal, and it's a school district issue because the property tax rates are set by the school boards specifically, but it's based also on how much dollars are coming from the state for each school district, so that's why it's a state issue as well. One of the problems in our area is that because of the formula for how those dollars are driven out from the state, we tend to get less per student or less as a percentage of our total budgets than some other areas across the state. And I don't want to spend too much time on that, but I could tell you a lot more about why that is the case. But the fact of the matter is something does need to be done. We had started while I was there a process that is gradually changing new dollars going to education spending and distributing them in a better way that has helped our school districts here and helped to keep taxes down to some degree, but it's going to take a little time before that gets worked through. But anyway, while I was in the state Senate, I voted to eliminate property taxes and provide for other ways, provide options for school districts to raise dollars other than through property taxes, and I still would support expanding the options. But certainly we need to do a lot of work to ensure more equity across the state, which would help here. So I hear you. I would encourage you to talk to your school board members about that, as well as your state legislators. But fully aware is one of the top issues here in our area in regards to the state legislature and state policy. But thank you so much. Let's go to, is it Elizabeth? Elizabeth Messinger, are you there?
Yes, thank you. Hello?
Hi.
Hi. Just a quick question. It's off the topic a little bit.
Sure.
We are Medicare people, and we have to choose our prescription coverage by December of the previous year. So in December, we had to choose which company we wanted to have prescription coverage with. We do shop, and we pick what's best based on prescriptions that we have that are ongoing. Come January 1, we're finding that companies can come back to us and say, our formulary has changed, and we no longer are going to cover the prescription that you've been maybe taking for years. In our case, particular eye drops. They're telling me that they do not have contracts with the insurance company. I guess my problem is that we're relying on information supplied that we have to, by the company, the insurance company, that we have to go choose in December of the previous year, and then they can change their formulary come January 1 of the following year. And unfortunately, we are locked in. We cannot change insurance companies. We have to go through the entire year. Is there anything that can be done, or is this just part of the whole insurance that needs to be reformed?
Well, we should not be requiring you to make decisions without, that can, based on information that can then be changed, which is detrimental to you. And so I don't know exactly what the answer is here. This is really the first I've specifically heard that exact issue, but we will certainly look into it for you and see, learn more about it and see whether any changes could be made. I have members of my staff, particularly Noelle, works in the D.C. office. We'll have her check into this and see what we can learn. We have your telephone number, so I'll get back with you specifically.
Okay.
But we'll be glad to share information more broadly as well, because this may be an issue for others. So I really appreciate you bringing it to my attention. I'm sorry I don't really have an answer on it right now, but we are happy to help. We'll look into it, and we'll be back in touch.
Appreciate it. Thank you.
Thank you so much. Let's go to Earl from Paradise. Are you there?
Yes. God bless you. I had mentioned when I talked to your helper about the virus uptick, and I'm sort of noticing that a lot of Amish don't seem to think it's necessary to wear masks. I'm seeing, but that something else came up. One of your other callers brought this up, and my wife and I were talking about this before your phone call. So, and that involves the property tax reform. I was just sharing with my wife how we moved in the house we're now in 1980. So we've been here 40 years plus. And the first year we were in the house, I think the property taxes were right in the neighborhood of $400.
Mm-hmm.
And so in 20 years, it's increased tenfold. And the wages if I would have been still working, I'm 74, the wages haven't increased tenfold. And and now I'm on, we're on fixed income, which is very low. And so I think that, and I guess, you're not the one to be dealing with this because you're a federal congressman, but
yeah, I hear you though.
But it really, I don't know what the holdup is to really dealing with it effectively, except that I think most of the school districts sort of feel like we need more money.
Yeah, I'm gonna.
We can't get enough money, And
yeah.
And so
I'm going to stop at only. I'm going to stop you at that only because there are a lot of other questions I want to get to, and I think I got the gist of what you're saying. And I apologize for cutting you off. But yes, I've talked to so many individuals in exactly your shoes, lived in the same house for a long, long time, are fixed income, and some have told me they may not even be able to keep their home just because of the property taxes. And so I fully understand the impact on someone in your shoes, even the impact of someone who's buying their home for the first time who may have higher property taxes than their mortgage. And so it's an issue that there's a continuing need to address it. It's multifaceted. I covered some of that previously. I'd be happy to talk with anyone more about it and give some more opinion. It's just that it's better directed to the state and the local school districts, and I encourage you to do that. And it sounds like you already have. But you also wanted to mention about the COVID cases. You mentioned a little bit about the number of cases and the response to it in our community, the Amish and others. I guess I do want to mention we have been getting regular updates from some of the experts throughout this entire time, starting in January. And I'm certainly not an expert in this, but have learned a lot, and I'm happy to share anything that we heard. Just recently, we had another briefing from an individual by the name of Dr. Scott Gottlieb, who's a former FDA head of the FDA, who I think is spot on in terms of his predictions on this virus and where we stand. What he said is that we're not through it yet, and we need to continue to do the social distancing to stop the spread as much as we can. And so masks, I would recommend, you wear masks when you're in public, wear masks when you're in buildings with people you don't live with, and continue to practice the social distancing guidelines. It's protecting ourselves and others as well. But, everybody at the end of the day makes decisions for themselves, and we just ask that, you not only concerned about yourself, but concerned about neighbors and others who perhaps may be more susceptible to the virus. So I'll stop at that. We'll go to the next question. Let's go to Walter Campbell. Are you there?
I am, sir.
Hi, Walter. Good.
How you doing?
Good. How are you?
Good. I'll try and be brief. My question is, do you ever see the days of when Republicans and Democrats can work better together? Seems like the parties are so far apart, and I'm thinking back maybe 10, 20, 30 years ago when there seemed to be a little bit more harmony than there is today. Thank you.
Sure. You look back 20, 30 years ago. You could also look back maybe just 3 or 4 months ago. And I agree with you. We are too often so polarized that it's difficult to get things done that need to be done. And sometimes that's just because they're just very different ideas. And, Congress is intended to be a body where you come together and you have vigorous debate about ideas, and then you are able to find common ground to move the country hopefully in the right direction. And the reason I say 3 or 4 months ago is because I never saw the kind of swift action that was taken to respond to COVID. And there were multiple bills that where Republicans and Democrats came together and almost unanimously responded in a necessary way. And really, I think, helped a lot of individuals, families get through this, and helped a lot of businesses survive when, in many cases, some of their revenue was 100% gone. Others were impacted, some of the, and maybe not 100% closed down, but impacted drastically. Without the PPP plan, without the assistance to individuals and families, it would have looked far, far different. And I am despite, there's some things in the CARES Act that I would not have done it in exactly that way. There are things even in the PPP program. This is the program that helped businesses. I would have liked to seen some more controls on that. The unemployment, I thought, was in some ways incentivizing people to stay on unemployment rather than going back to work. There was some things I wouldn't have done in exactly the way we did, but it really was Republicans and Democrats coming together, knowing we had to do something, and by and large, it was very, very, very successful. And boy, I wish we'd see that more. Unfortunately, you're right. It doesn't always happen. And I think the country would be better if we were able to work that way more frequently. I'm a part of a group, and I'm a conservative Republican representing a conservative Republican area. But I'm part of a group that includes Democrats and Republicans. There's 25 of each, called the Problem Solvers, with exactly that in mind, knowing that we don't always agree on everything, but we should certainly have respect for another viewpoint, and we should have vigorous debate, a free flow of ideas that leads to better solutions. Some of the best solutions coming out of Congress, the longest lasting solutions, are those that have strong bipartisan support. And that takes vigorous debate to get to that point. And so, that's the way it should work. We know it doesn't always work that way, but we've seen that recently, and that's what we should be shooting for at all times. That's certainly the goal of this Problem Solvers group. So thank you for that question. Appreciate it. Let's go to Nora from Columbia. Are you there?
Yes. Good evening, Congressman.
Hi.
Hi. Good evening.
Good evening to you. What's on your mind?
What you just said now leads right up to what I was saying to your assistant. I appreciate all your hard work. I know it can't be easy what you're doing, and I do appreciate everything you've done so far to help us. I would just say my observation has been, I think part of the reason this has been so challenging, having the COVID-19, is just because there isn't a consistent message coming across. Dr. Fauci and Dr. Birx, I completely respect them. I think a lot of people, regardless of their party, look to them because they are the medical experts. I just like they get kind of pushed. More recently, they were pushed to the background in a time when I think they needed to be the ones leading. They lead the task force and they set the example, and they're saying things because it's medically recommended. So I think that's been part of the challenge. I would just say, please keep them out in front. I just think that'll help a lot. Take out the politics of what's going on. Whether mask, no mask, all these things. That whatever they say or whatever the medical community says we need to do, I just think we all need to get behind it and I think we'll get through this a lot quicker, a lot less painfully if we can do that.
Yeah, I appreciate that perspective and couldn't agree more. This is a real threat to the country that none of us were expecting, and requires all of us to participate in defeating it.
Right.
And we should be listening. And I think Dr. Fauci has been outstanding. I already mentioned Dr. Gottlieb, Dr. Birx. There are a number of who not only have spent their life's work preparing or studying pandemics and viruses like this, but
exactly,
at a time
right.
like we really need their expertise here.
Yeah.
And even I feel then on the other hand, some governors, including the governor here, and I don't know how you feel about this, but I believe this should all be data driven.
Oh, absolutely.
And one of the things that I was concerned about is that we didn't respond quickly enough to reopen after we realized that the fatality rate was not what we thought it may have been at the beginning. We realized that we can safely interact to a degree if we practice the social distancing and the masks and so on. And I think the economic damage was not being adequately factored into the decision making, because it is a drastic step to close down the economy. It's never been done.
Well, we've never had the virus. Yeah, we never had the virus.
True.
I think that
Wolf
did try to do. I mean, we've never dealt with anything any of our lifetime. So, what was the right way to go? I was going to go to Florida this month, and look what's happened in Florida. And it 200,000 cases in a matter of a month. I mean, we only have 90,000, which is plenty of cases, but I mean, they're just exploding. Yeah. So I give Governor Wolf credit. We're self-employed. It was, but I'd rather have my health for now, and hopefully my job, we can get back to work and all those things. But if I'm not healthy, I can't work. That's the bottom line. So, I'd rather know the truth. All I say is I'd rather know the truth, no matter how brutal it is. I'd rather you tell me the truth, and then we can deal with it.
Yeah, I couldn't agree with you more. I thank you for that perspective. I think we can, and we've shown we can safely reopen and still keep the virus in check.
I hope.
So thank. In fact, I'm going to just one other point. In the call that we had just recently, this may be interesting to everyone that I just mentioned. One of the briefings we got. The case rates will continue to go up probably as we have more testing. And so we should expect you're going to see more cases. And in fact, the number of deaths may rise briefly still going forward. But what's really important to look at is the death rate, which will continue to decline going forward, because there are some promising treatments that really are having an impact. We know now, this is interesting to me, that a blood thinner is an effective treatment to help reduce the number of fatalities. They've learned that some people who died suddenly from it, the doctors were seeing cases where an individual seemed to be stable. Doctor would leave them, and a few hours later they suddenly passed away from this. They learned that was frequently caused by blood clots in the lungs. We were just told this by Dr. Gottlieb. And so a blood thinner has helped to reduce the fatality rate, according to him. I found that to be very interesting. I'm not a medical doctor, so I'm not an expert on this, but it was interesting to see that. And then there's a steroid that has been working. And then, of course, remdesivir, all are helping to reduce the fatality rate as we go forward. All right, let's go to Wendy from East Earl. Are you there?
Oh, I'm so excited.
How are you?
I've actually been on like 4 times with my questions, and this is my first time.
I'm sorry.
First of all, thank you for holding these.
Yes, sure. Of course.
I appreciate you taking the time to do it. I actually have just 2 questions because one, they both affect me. I'm a school teacher, and so one would be, what do you anticipate as the federal response to COVID for public schools in PA? I think our school districts and our state's going to carry a heavy burden with some of the preparations that are going to have to be made with nursing staffs and sanitizing and things like that, and I just would like to know about the federal response. And also, my son is a police officer in Pennsylvania, and so my question is about, at some of these rallies, and even most recently, you're probably aware, at Lancaster Market, there was a gentleman carrying an assault rifle because he has the right to carry, to open carry in Pennsylvania. And that's a big concern. That doesn't make sense to me, that someone would be permitted to carry around an assault rifle. And so those are my 2 questions, just near and dear to my heart because of what I do and what my family is involved in.
Sure. Thank you for your work as a teacher. Can I ask where you teach?
Eastern Lancaster County School District.
Okay, great. And what grade do you teach?
I teach 5th grade.
Fifth. And
Elementary.
how was it? Yeah, how was it for you to transition to online learning?
Well, I think I've got to tell you, I was really proud of our district, just how things were rolled out pretty smoothly. It was well planned. We already had computers in the hands of our students, when they were sent home, and so that really helped us. My district did some great professional development opportunities for teachers. Mm-hmm. And so honestly, I thought it was the best that we could provide for our students. I had good participation from my learners. And so I think it was, on an emergency level, it was the best that we could provide. And I really am proud of it.
Yeah, and I was talked to a number of administrators and others in education, and was really proud of what the schools in our area have done to address this and switch to online learning. My son just came through as a junior at Lane Peter Strasburg. And it was a lot of work to switch to online learning, and that was great for you to do that. How do you feel about going back to school? I'm just curious.
Well, I'm hoping that we're able to, certainly, because nothing beats being in front of my students, and making those connections. But safety to me is paramount for both them and for me. I have a father that resides with us currently, and he's 90. So I just have to protect my family too, and so, but I'm hoping that we can return. But we also, I think, need to be ready to go online at a minute's notice. So.
Yeah. So I think, and again, thank you. But I think every administration, every teacher is beginning to make plans for how we can safely go back. In regards to the federal response, at the federal level, they are encouraging schools to reopen. They believe that we can do so safely. Our Secretary of Education here has said that we fully intend for schools to be open in Pennsylvania as well. I think they should be, and it's going to be tough because the guidance is potentially that students would have to wear masks, and it's going to be tough to do. But I think there's also, just like there's an economic impact when we close down the economy, there's a real impact on students that are missing out with learning, and better than anyone that learning builds on the previous year, and so how far will students be behind, and how will we get caught up on that? And so I think if at all possible, we've got to get kids back into the classrooms, and I think we're going to be, certainly the guidance from both the state and the federal level is to do that. And in
what about dollars? I'm sorry. I was just wondering, what about any federal monies that are being discussed?
Well, there has, the state of Pennsylvania, for instance, has received about $5 billion, and they can choose, there's some restrictions to that, but, there are dollars there that have already been provided to the states. We're open and listening to what other needs are out there. I do believe, as I mentioned earlier in the call, that there will potentially be another, another bill to address COVID and provide additional resources. I think our leadership took the right approach, and that was, we got to give it a little bit of time, ensure that the dollars that have been distributed so far are driven out effectively and efficiently, and so on and so forth. And then, see where there is additional need, and then target that need as specifically as we can going forward. So I'm sure education will be part of that discussion. I'm not able to tell you right now exactly what that may look like, but fully aware of the impact on education as well as other areas, and I'm sure it'll be part of the discussion.
Right.
So,
thank you.
Thank you.
Could you do you have time to talk about that second, the open carry AR?
Yeah, so that open carry at Market was not, you had mentioned, as part of a protest?
No, he just showed up. He said that if you look in the paper, he said that he was carrying it, in case he was asked about wearing a mask. And I just think, wow, that just shocked me.
And you're exactly right. Pennsylvania law currently allows open carry and concealed carry with a permit. And I don't know what response there has been at the Pennsylvania level in regards to a situation like that, but like he was within his rights to be able to do that. I understand the concern, and I don't know whether Pennsylvania would consider any changes. He was peaceful and was within his rights to do that, but it certainly generated some response, that's for sure. Appreciate also your son working as a police officer, and we obviously, and I'll just address this very quickly because we want to get to another call or two if we can.
Sure.
But I've talked to a lot of police officers and chiefs in the district, and all of them have been absolutely appalled with what they saw with the death of George Floyd. What I am concerned about, this whole idea of defund the police is the craziest idea that I've ever heard, I believe. But, every department in our area is looking at their own practices, ensuring that, they're doing the best they can to not only, to work with their community and provide the best possible service. And I'm really proud of them for doing that.
Absolutely.
They're looking, they know when a cop is, not doing something correctly. They don't like that either. And they understand that, if there's a cop that is just, repeatedly doing something wrong, he needs to go. I've just been really, really proud of talking to police all across our district. I want them to know that we appreciate the work that they do to keep us safe. We support them, and they themselves are, want to do the best they possibly can, and they're working to see if there's anywhere that they can improve their practices, and they like the idea of a sort of a federal database of police who have misbehaved, so they can't get hired in an department and so on. So I'm going to try to sneak in one call.
Thank you so much for your extended time. Okay.
Thank you. Yes, you bet. All right, let's go to Bob from East Lampeter. Are you there?
Yeah, I'm here.
How you doing?
I keep waking up.
I'm sorry?
I said I keep waking up.
What's on your mind? We've got a couple of minutes.
How many of those COVID-19 deaths or how many of those deaths people die from something else, but because they have COVID, they give it to the COVID-19?
Yeah, Bob, I get what you're saying, and you know what? I'm sorry. I'm being told we're at the end of our time here. But Bob, it is important that we accurately track the deaths from COVID so that we know more about doing it, and we could talk a little bit more about that. We're unfortunately out of time. If you are on the call and we haven't gotten to you, I apologize for that. But if you stay on the line after I hang up, you can leave a message and we'll get back with you. Either I or a member of my staff will give you a call, and particularly if you have any particular issues that we can help you with, please stay on the line. Let us know. We always like your questions and your comments. So thank you all for joining me tonight. I'm sorry that we ran out of time before we get to everyone, but I wish you all stay safe, stay healthy, and wish you all a great night. Thank you.